Thousands of older adults mistake these symptoms for normal aging. Every year it's common to assume that fatigue, forgetfulness, or slower movement are simply part of growing older. While some age-related changes are expected, others may deserve medical attention. Today, we'll look at 15 symptoms that should never be ignored, simply because of age. Number 1. Memory problems that gradually get worse. Occasionally, forgetting a name or misplacing your glasses happens to almost everyone. However, memory changes that gradually become more frequent and begin interfering with everyday life deserve closer attention. Forgetting important appointments, asking the same question repeatedly, getting lost in familiar places, or struggling with tasks that once felt routine are not changes that should simply be dismissed as old age. There are many possible causes of worsening memory. While dementia is one possibility, other conditions including medication side effects, depression, thyroid disorders, sleep problems, vitamin B12 deficiency or infections can also affect thinking and memory. Some of these causes are treatable, making an early evaluation especially important. If you or someone you love notices memory problems becoming more frequent or affecting daily independence, schedule a medical evaluation. Identifying the cause early may improve treatment options and help preserve quality of life. 2. Swelling that lasts. Swollen feet or ankles are often blamed on spending too much time standing or sitting. While that may occasionally be true, swelling that persists, keeps returning, or gradually worsens deserves medical attention, especially if it affects both legs or becomes increasingly uncomfortable. Persistent swelling may be associated with circulation problems, heart failure, kidney disease, liver disease, or side effects from certain medications. Sometimes swelling develops slowly enough that people simply adapt to it instead of recognizing it as a symptom. Worth discussing with a healthcare provider if swelling continues for several days, becomes worse over time, or is accompanied by shortness of breath, chest discomfort, or sudden weight gain. Seek medical advice promptly. A proper evaluation can help identify the underlying cause and determine the appropriate treatment. Number 3. Persistent fatigue. Feeling tired after physical activity is completely normal, but feeling exhausted almost every day, despite getting enough sleep, is different. Persistent fatigue isn't simply about having less energy. It can interfere with walking, cooking, exercising, and enjoying everyday life. Long-lasting fatigue may be linked to anemia, heart disease, thyroid disorders, sleep apnea, diabetes, medication side effects, poor nutrition, or other medical conditions. Because fatigue develops gradually, many older adults assume it's simply another part of aging and never mention it during routine checkups. If fatigue lasts for several weeks or noticeably limits your daily activities, it's worth discussing with your healthcare provider. Finding and treating the underlying cause may improve both your energy level and your overall health. Mark 4. Unintentional weight loss. Many people don't notice gradual weight loss until their clothes begin fitting differently, or family members point it out. Losing weight without intentionally changing your diet or exercise routine should never be ignored. After age 75, unexpected weight loss may be related to reduced appetite, dental problems, difficulty swallowing, digestive disorders, depression, thyroid disease, medication side effects, infections, or other medical conditions. It may also increase the risk of muscle loss, weakness, and falls. If you've lost a noticeable amount of weight without trying, schedule an appointment with your healthcare provider. Identifying the reason early may prevent additional health problems and improve your overall well-being. 5. Shortness of breath during everyday activities. If simple activities such as getting dressed, walking across the house, or climbing a few stairs suddenly leave you unusually breathless, don't assume it's simply because you're getting older. Shortness of breath may be related to heart disease, lung disease, anemia, or other medical conditions. Any new or worsening breathing difficulty deserves medical evaluation. Number 6. Frequent dizziness. Feeling dizzy once in a while may happen for many reasons, but dizziness that keeps returning should never be ignored because it increases the risk of falls. Recurring dizziness may be caused by dehydration, blood pressure changes, medication side effects, inner ear disorders, or heart rhythm problems. Speak with your healthcare provider if it becomes frequent. 7. Changes in walking or balance. Walking a little slower can be part of aging. But suddenly, feeling unsteady or stumbling more often is different. These changes may increase the risk of serious falls and injuries. Balance problems may be linked to vision changes, nerve disorders, medication side effects, muscle weakness, or neurological conditions. If walking becomes noticeably more difficult, it's important to have the problem evaluated. 8. Difficulty sleeping that persists. Many older adults experience changes in sleep patterns, but ongoing insomnia isn't considered a normal part of healthy aging. Poor sleep can affect memory, mood, concentration, and energy levels. Sleep problems may result from chronic pain, sleep apnea, anxiety, depression, or medication side effects. If poor sleep continues for several weeks, discuss it with your healthcare provider now. Loss of appetite. A reduced appetite for a day or two usually isn't concerning. However, eating less for weeks at a time may lead to weight loss. Muscle loss and poor nutrition. Loss of appetite may be related to dental problems, digestive disorders, depression, medications, or other medical conditions. Persistent changes deserve medical attention. 10. Changes in vision. Vision often changes gradually, making it easy to overlook problems until they begin interfering with daily life. Difficulty reading, blurry vision, poor night vision, increased sensitivity to light, or losing part of your visual field should never be dismissed simply because of age. Several eye conditions become more common after age 75, including cataracts, glaucoma, age-related macular degeneration, and diabetic eye disease. Many of these conditions develop slowly and may not cause pain during the early stages. Without regular eye examinations, permanent vision loss can sometimes occur before obvious symptoms appear. Routine comprehensive eye exams play an important role in healthy aging. If you notice sudden vision changes, flashes of light, a curtain-like shadow, or significant loss of vision, seek immediate medical care. 11. Difficulty swallowing. Many people occasionally cough while eating or drinking, but if swallowing becomes painful, food frequently feels stuck, or meals begin taking much longer than usual, these symptoms deserve medical evaluation. Difficulty swallowing may result from acid reflux, neurological disorders, muscle conditions, or problems affecting the esophagus. Left untreated, swallowing difficulties can increase the risk of choking, dehydration, malnutrition, and aspiration pneumonia, rather than changing your diet. Without knowing the cause, speak with your healthcare provider. Proper evaluation can identify the underlying problem and determine the safest treatment approach. 12. Persistent changes in bowel habits. Digestive habits naturally vary from person to person, but lasting changes shouldn't simply be blamed on getting older. Constipation lasting several weeks, ongoing diarrhea, blood in the stool, or a noticeable change in bowel patterns should always be discussed with a healthcare professional. Possible causes range from medication side effects and dietary changes to digestive disorders or other medical conditions, although many causes are not serious. Persistent symptoms should still be evaluated rather than ignored. If bowel changes are accompanied by severe abdominal pain, fever, significant weight loss, or rectal bleeding, seek prompt medical care for further assessment.